typical symptoms experienced by methamphetamine-abusing clients. And we separated out by men and women. And this is an actual published study. First such study to do this analysis of symptomatology by gender. So weight loss is experienced pretty universally by everybody, at 84%. Sleeplessness is experienced pretty much by everybody at the same rate. About 80% of the people have sleep disturbances. What does that do to behavior? Financial problems, that's a duh.
That's a duh.
Paranoia, okay, happens in about 2/3 of the people. Legal problems, another duh, about 60-something. But many people do manage to escape legal problems. They have money, they have connections, whatever. Hallucinations. Now, please notice who has hallucinations more frequently.
Meth people.
Yes. Which gender? Men. We don't normally think of men just automatically thinking of men suffering hallucinations. But hallucinations are extremely common with methamphetamine abuse. And they can, the exposure to methamphetamine can kindle this as a lifetime disorder. There is some evidence to suggest some people develop, now we don't know cause and effect, sustained paranoid schizophrenia that is kindled by the use of the drug and does not go away. The switch might have been turned on in the brain by the drug. Work problems, another duh, but look at the gender difference. Now that work problem, now think about this, it's going to be problems of aggression. Women are more socially competent generally, and so on. So that suggests that we're really going to have to work on that as a domain. Violent behavior.
That one surprises me.
But both genders are equally likely to show violent behavior.
Yeah.
It's like it turns folks mean.
Yeah.
And dental problems tend to have that worse than men. Meth now is more common. Actually, one of the major principal reasons is that the stimulant drug dries up the saliva, and also it also causes teeth grinding.
Yeah.
That's the elevation of the norepinephrine circuitry in the brain caused from part of the side effects of meth, which causes compulsive behavior and repetitive movements. It also causes the skin disturbances. It causes the actual itching things. So those are kind of related. And it's possible, though not scientifically documented, that the drug, the chemicals that may be affecting the teeth, one of the things might be is that methamphetamine is not a controlled pharmaceutical. Mm-hmm. It varies in quality. If you want to know the most pure symptomatologies, the very cleanest of analysis of methamphetamine effects, pay attention to the Japanese literature. Yeah. Because they gave away methamphetamine virtually like water during World War II. And their rates of addiction from other substances at that point were extremely low. So they have probably the world's only population of meth-only addicts. And that they were introduced to meth that was pharmacologically prepared.
Was that across the board the same?
The same.
Okay,
so it gives you a really nice sense. It's almost like a clinical trial.
Yeah.
Skin problems are exacerbated in women versus men. And the teeth. Yes. Now, then the cardiovascular problems are differential to men. The leading cause of death of meth consumption are cardiovascular events.